have a legislation that is critical to implementing what we need. Why today I am going to start on a bit of a sober note is also because, as I said, as we are raising awareness on mental health issues and advocating against social stigma, we have a reality in this country. If you have been watching the news for the last 1 week, 2 weeks, you must be depressed, as I am. To see the number of deaths, especially amongst couples or spouses, it's been a very sad time for Kenya. And even if we have COVID, it is not an excuse for the kind of level of violence that we are seeing. And so today, my Cabinet Secretary, together with the Cabinet Secretary of ICT, Professor Margaret Kobia, and Waziri Mushero, today they had a press conference on this issue. And I thought, because maybe some of you didn't catch it, and those of you who are here, let me just highlight what the government's mitigation is at this point, and I will be taking it from where they were. First of all, the government has set up a toll-free hotline. We've always had this hotline called 1195, we as a ministry, and we are repeating that there's a hotline, 1195. If you call 1195, you will be given the process of getting help if you are a GBV victim, where to go, which hospital, or which police station, how to get your OB, and most importantly, to get the help that you need, especially also psychological, which of course for me is very, very important. Under the police, we have the police hotline, I will say it twice, 0800 730 999. Let me repeat it, 0800 730 999. Now these services also are anonymous. Why I say that is because sometimes the victim will not go to get help, but a neighbor, a friend might be the one who needs to call. However, they might not want to be known as those who called. So that's why also I'm giving you the comfort, and the government is giving you the comfort that it's anonymous, and you'll be given counseling, and you'll be referred to medical and also legal services. The other thing that the government is talking about is the law and the enforcement of the law. This has been, for me, another critical thing if you've heard me speaking about it on GBV. Every time there is a GBV case, we find that the culprit goes and gets bail of some sort and is back on the streets. I remember a story in Kisumu where the lady had gone through a harrowing experience. When we were there as government and the women rep of Kisumu, she told us that the perpetrator was actually walking around. In fact, on that particular day, because he knew we were coming, he was stationed somewhere with a crowd of his, young men, as if threatening us also. I mean, it's amazing the kind of, it's amazing that perpetrators can go free, walk around, do as they please, because they have bail. And that's why we also have to wonder, what about the justice system? Maybe we're going to be talking today to my guest about government. My last guest was about legislation. Most probably I'll bring somebody from the judiciary to tell us what about the justice, because it's a whole cycle. And that's what I wanted to say for now. Those two hotlines, please remember them. And please know that you can get help. COVID is not an excuse for GBV. Please, COVID is not an excuse. And why I'm speaking about this is because I believe fundamentally that there's also a mental health issue around the kind of GBV cases we are seeing. It can't be that somebody can be normal, somebody can be, doing every day-to-day things in a normal atmosphere, but then go home and slaughter his wife and his children and commit suicide. It can't be normal. Again, the reason why, for me, we need to discuss mental health. We need people to know that there's a place they can go when they're feeling low and they need help, they're feeling depressed, they have issues of rage, they don't know how to control it. There is help. There is help out there. I have spoken about it in my last shows. So today, as I bring in my guest, Dr. Mwangagi, I will ask her to please join me. As she joins me, you all know her as the face of Corona. Dr. Mwangagi and her cabinet secretary came in at the time when COVID hit. So for her, it was baptism by fire, if I can say that. But she's done a great job, a sterling job, and the Ministry of Health has done a sterling job. I am quite sure, quite convinced, that Kenyans have felt a bit more comfortable, assured of how government is treating COVID, how we have intervened, and that's why I've brought her today. But I've also brought her today because she's a friend. I have spoken to her about issues, we have discussed certain issues. And that's it.
Thank you so much.
You are just not the face of COVID.
Not just the face of COVID.
You're not just the face of COVID, and that you are really a pillar for me when I'm discussing mental health, and I appreciate that.
Thank you.
We have been with other of our colleagues, and
yes,
we have had this discussion.
Yes, we have.
And I feel that the voice of government is the final comfort that persons with mental health need. I hosted Senator Kasanga,
yep,
and we've spoken about the legislation, and I've been also talking about the mental health task force that was set up by the president.
Yes.
And the interaction now between that mental health task force,
right,
the legislation,
right,
and of course what the ministry is already doing and has always done. My feeling is that we need to do more. And when we had that discussion, you agreed with me totally. We need to do more. But before we go into the nitty-gritty,
right,
beyond being the face of Corona, who are you? And as many Kenyans ask, are you single? It's a joke that has been going on social media. I'm sure you're used to it by now.
Shebesh, thank you so much, my friend,
Yes.
For giving us a chance to be here with you today,
Yes.
to share all the information that we have when it comes to mental health through this very valuable platform. I've followed your past two shows, I've seen the comments, I've seen the demand for it. There's actually a hunger for this information from the public, and so really congratulations for making this possible for people to be able to interact. Well, yes, I'm Dr. Mwangagi. I'm a medical practitioner and a health economist by training. I've been in this space now for